Hi, I'm Jake from Clinical Exercise, and today I would like to go over 4 of the basic exercises that I would do if you were coming out of physical therapy from a post-operation surgery for your back, or if you're in pretty acute back pain or you have a lot of back problems with chronic conditions. I'm going to show you 4 exercises that I would do as part of a program if you were to come in here and I'd work with you, but these are 4 simple things that you can do at home that's going to begin to, anytime you're coming off a back surgery, your muscles are going to be inactive from the standpoint of they're not necessarily flexible, they don't really know what to do, and because they've been in pain and trauma, they're probably tight. So a couple of the basic movements here we're just going to start with. I'm going to start you flat on your back on the floor so that you're nice and stabilized, and we're just going to initially work on abdominal breathing. And abdominal breathing is just drawing the air into your stomach, letting your stomach rise, and then breathing out and letting your stomach gently pull in. And this again is just designed to activate and utilize the muscles in your core and in your lumbar spine to begin to slowly activate those muscles from that post-surgery condition that you've had. From that, we're going to start to actually stabilize the core muscles a little bit. So what I want you to do is I want you to put a fingertip on each of your hip bones here, and we're just going to go back and forth, and we're going to pick up one foot. I don't know if you can see that on the video, and then we're going to just pick up the other foot. And the idea here is you want to imagine having a glass of water on your stomach, and you're not going to let that water spill. So I want you to keep those abdominal muscles tight, and you're just going to lift one foot, back down, and then lift the other one. And you'd be surprised how challenging this is for anybody that's had acute back pain or post-surgery conditions. Once you've mastered those 2 basic ones, we're going to move into a floor bridge. And the floor bridge now is we're going to start utilizing those hip muscles that connect to the back and start bringing back in the strength and condition. Keep the knees nice and straight. Focus on squeezing your glute muscles as you pick up. Squeeze your glutes. Tighten those abdominal muscles just a little bit and begin doing some bridges. Most of these movements, 12 to 15 repetitions, 1 to 2 sets, once to twice a day is ideal for starting to get those muscles back in condition. And the final one, we're going to move to hands and knees, and we're going to work on what we call the cat-cow. This is from yoga, and the cat-cow move is you're going to get your wrist directly under your shoulders. You want your knees directly under your hips, and we're just going to gently push the back up to the ceiling and drop the head at the same time. And then starting at the pelvis, we're going to reverse that the other way. We're going to take our back into a nice arch and gently lift our head. So the movement's going to look like this, and it's going to rotate and then look like this. And that's going to actually now activate all of those muscles and begin to get the range of motion back in there. So those are the 4 exercises that you want to be doing at home. If you're dealing with a lot of back pain or if you're coming out of post-physical therapy from a surgery, that's where you want to start.